Hello, good evening, everyone. Wherever you all are from, welcome you all to the SSERD Space Talk. I know we were late little today again, but we are ready, and I hope you all are ready too. So before I start off, SSERD is an organization which is started with an intention to promote space education among the young generation of the whole world. So basically, we do a lot of programs in order to reach out to students and talk about space. And one of such program is Space Talk at SSERD. Space Talk at SSERD brings in a lot of professionals from space-related backgrounds, and we let them share all their knowledge that they have and how are they connected to space and how did they make their career out of space. And we'll also know a little bit about their personal journey and their work experience and etc. So this particular space talk is going to take us through another huge domain that we never focused here in India. So let's know who is our speaker. I'll read out a short bio of him. It's a lot, but I'll try to tell in very short so that you'll all get to know about him. At the same time, he will also share what is the work that he has done and a lot of things. So today's space talk is on a topic called space medicine. As I said, it's pretty new. You know, most of them asked us, "What is there a career called space doctor, and what exactly do they do, and how does the thing work and everything?" So today's speaker will answer all those questions. So let's know about today's speaker. His name is Dr. Ashok Narayanamoorthi. He's a clinical surgeon, and he's been working, and he has a lot of interest in this field. Dr. Ashok is a highly skilled flight surgeon, also having rich global, intercultural, and interdisciplinary experience in aerospace medicine and clinical research. He obtained his medical degree from Madras Medical College under the Dr. MGR Medical University. He did his residency at the Institute of Aerospace Medicine under Indian Air Force, affiliated with the Rajiv Gandhi University of Health Sciences. With all these studies he did here in India, also he did his aerospace medicine research rotation at NASA's Johnson Space Center, affiliated with University of Texas. He's also one of the analog astronaut. Again, most of us not aware of something called as analog astronaut. We all know what is an astronaut, what do they do and everything. But then this particular term is called analog astronaut, and we'll know more about him with his experience of being an analog astronaut and what exactly it is and everything. With his experience of being an analog astronaut in PoSSUM, it's called Polar Suborbital Science in the Upper Mesosphere. Other than that, he was also the analog astronaut at the Mars Desert Research Station. It's called as MDRS. So these are his few experiences, few things that I shared here, but a lot. Let's hear from him. And hello, sir. Can you hear us? Welcome you to the SSERD Space Talk.
Hello all. I can hear you. Thanks for the kind introduction.
Thank you very much. And as I was telling you from the beginning, this is something that most of us haven't heard at all. And thank you for accepting our invitation to join us and share more details on this whole new topic called as space medicine. Thank you so much. And I leave the screen to you. You can take over with your presentation and the talk that you would like to give for all our audience.
Thanks, Nikita. Hope everyone is able to see me.
Yes.
Can you see my screen?
Yes, actually I can see myself, so I can see your screen properly. Yes.
Okay.
Awesome.
Okay, that's awesome. Uh, so before starting the presentation, uh, good afternoon, good evening, and good morning to everyone. I believe many of them are in different time zones, and I
Yes,
really
we have
appreciate.
received registrations from almost 12 different countries apart from India as well. So very vast, diverse people who are listening to our talk. Yeah.
Before going into the presentation, Happy Independence Day to everyone. Uh, I just want to give a brief disclaimer. I have tried to be as accurate as possible. This is based on my experiences and the experiences shared with me by other colleagues and astronauts. You can feel free to share the images, but give them the due credit. The aim of this presentation is for you to understand what is space medicine and how does the space medicine works. Basically, the space medical point of view, and prepare yourself if you are a medical personnel or a paramedical personnel. If you are interested in career in space medicine, then this will be an eye opener for you. Uh, 14 years ago, my journey started towards space medicine. I have never come across this specialty. I believe many of you may not even have heard about this. So after this presentation, you can prepare yourself towards the career in space medicine industry. So first, we will discuss about what is an aerospace medicine. It's a clinical residency. You do that after your medical college or medical school, depending on the country where you are studying. And basically, it deals with the health and medical problems of the personnel in Earth atmosphere, and in space. Space medicine is basically a subset of this residency, aerospace medicine, where it mainly focus on effects on human body of space flight and how do you overcome those. On the picture on the left, you can see my daily duty as a flight surgeon in the aviation industry. On the right, this is the picture taken from the Apollo mission control from the flight surgeon desk. So how is the specialty different? Whenever you go to a hospital, you see many number of specialties on their board. But I'm sure if you have not gone to Apollo Medical Chennai and Max in Delhi, you have never would have come across aerospace medicine or an aviation medicine. The regular specialty discusses about normal environment and abnormal physiology. So basically, you're dealing with a normal surrounding and abnormalities in an individual. But in aerospace medicine, the environment is abnormal, and you are putting a normal person into it and see what is the normal reaction to that environment and what is abnormal. So you have to really focus upon your physiology to understand the specialty. So my background, I started my medical career in Madras Medical College with MBBS. So as everyone who is doing their medical college, they will be focusing on the post graduation. But I was a little bit confused. I was not sure that what should be my specialty. It was swinging from one to the other. So I thought maybe I should make my decision during my internship, or it is called as house agency in India. That time I was looking for different specialties. I used to think a lot about pilots and astronauts in my school, but after my grade 8 and 9 and 10, your focus shifts on your stream, and I was thinking about doing medicine or engineering or in mathematics. Then in my medical career, I was thinking that why not combine both. So I was looking for different kinds of specialties. Then I stumbled upon the specialty called aviation medicine or aerospace medicine. So I did my residency in aerospace medicine as a civilian candidate in Institute of Aerospace Medicine. It's part of Indian Air Force. So the selection process is basically all physical and mental fitness, and you have to be cleared as an officer level cadet. And when I was doing my residency, there was no bonds, but right now I believe there is a bond or a short service commission where you have to serve in the Indian Armed Forces for 5 years at least. Then I was interested in clinical research too, so I started working on it, and that was a side career for me. Clinical research, pharmacovigilance, and drug safety. I was working as a medical reviewer in an US-based clinical research organization. Simultaneously, I was pursuing my efforts in space medical industry. At that time in India, it was in a nascent stage. Human spaceflight was really unheard of beyond the efforts performed during Rakesh Sharma's time. It was literally in nascent stage. So I thought maybe I should collaborate with the NASA, and it took me an year to get the security clearance to get into Johnson Space Center, and I was working towards the Moon, Mars, and near Earth asteroid. It was a fascinating time during that period, and I started working on several certifications and operating several simulators, and then I did my space studies program with International Space University, and currently now I am a flight surgeon and an aerospace medicine instructor. So you would be wondering, like, oh, how do I get into space medicine career pathway? So basically, you have to complete your medical degree. Then you can directly go into aerospace medicine residency, or if you are interested in other clinical residencies, you can do a fellowship in space medicine and then be part of the space medicine team. But the team will be always led by the space flight surgeon who has done his aerospace medicine residency. If you are from other residencies, paraclinical and non-clinical residencies, still you have scope in there, and you will be part of space medicine research team. So we have to expand our horizons beyond doctors. So who can get into these teams? You can see in the screen, like there are several allied sciences who are part of the space medicine team. I was really astonished to see the different streams in a team. Like I really never knew 10 years ago that the space medical team would be this big. And usually it is the bigger space medical teams are seen in the United States and Russia. And I have heard from my colleagues that even China has a bigger team, and India is actually started developing one in-house. What would be the medical roles? The flight surgeon would be the lead for the team, and the psychiatrist and psychologist would be important part of right from the selection until the training, and they will be helped by the medical specialists and remote medical monitors. The picture in there shows the mission control center at NASA, where an extravehicular activity was supposed to happen. So we were watching from the window and to see like how the frontline team is performing. So what would be a daily work schedule in the spaceflight clinic? It is somewhat similar to the aviation or the flight clinic. So you get involved from crew selection, medical training, medical management, and you have to perform periodic medicals. The very important part is the in-flight support. Once the astronaut or the cosmonaut or the Biomnaut gets launched, you have to be in support 24/7. And apart from that, you do research too. So you can see the training in the hyperbaric chamber and the acceleration profile done in the aircraft and in the simulators. So the astronauts work in the similar environment. The first thing I want to elaborate is the crew selection. There are several standards for all their, which is specific for their respective space agencies. And you can see certain forms, like there are different stages. And the major part is the personality. Personality of an individual is very, very important, be it a government-sponsored space flight or a commercial space flight. Personality is very important. You have to adapt to those environment. You have to adapt to the isolation. Usually, military flying and diving experience are preferred. So this is one of the common questions I receive. how can I become an astronaut or a cosmonaut or a Biomnaut? So there are two different pathways. First is the government selected astronauts, and the second pathway is the commercial one. The government specific standards, they do announce periodically. Recently, they have made an announcement for NASA. A couple of years ago, there was an announcement from India, but it is not for general. They selected from the test pilots. And usually the government requires nationality. It's a very, very important thing for them. But if you see the commercial side, the standards are usually liberal, and you have to meet the cost of the training and the flight. And we are expecting the commercial spaceflight industry to take off in the coming 2 years. And probably in our lifetime, we are going to see something similar to what happened to the aviation industry. So the tiebreaker, usually in the government-sponsored astronaut recruitment, they get like a lot of application. For every seat, they get around 10,000 or even goes into lakhs of application. So they filter and they form the main crew and the standby crew. The tiebreakers will be if you have a flying experience, multiple language experience, military experience, or specialized skills. So you should be like master of all trades. And if you are a leading expert in an industry, then it would be a tiebreaker. We have seen like several times most of them have exceeded their expectations. How to decide who will be selected? So we have to use the criteria for exclusion. So in government selection, you see exclusion, like you have multiple choices, but in commercial, it will be inclusion. Like even if you don't meet a certain criteria, you'll be getting certain waivers. So what would be an ideal team? So it should be the space crew team should be an international team, multicultural, cross-disciplinary, and experts in their field, or in the path of becoming an expert. We so far saw about crew selection. It's a very important step. Why is it important? Because there are many stresses of space. The most important is radiation, microgravity, and isolation. These three are major factors which decide the mission, whether it will be successful or not, when seen from the medical perspective. And the other stresses you can actually acclimatize and accommodate yourself so that you can prepare yourself. This is part of your medical training in the indoctrination course for astronauts. If you see, even the circadian rhythm or the biological clocks plays an important role. Why? Because the International Space Station is at the universal time zone. So you have to adjust yourself to the time zones, and everyone knows that the International Space Station it makes a revolution around the Earth for every 90 minutes. So what are the medical emergencies we can expect on board? Usually they are injuries, usually minor injuries, scratches, abrasions. Those are the major things which we encounter. And we have to be really careful with food. And there is a separate food and nutrition team for each and every astronaut who calculate their calories and what is their preference. In the earlier times, you don't have much choice of food, but now we have almost everything in a dehydrated form where you can use it on board. And extravehicular activity is a very important timing where you have to be really careful right from the preparation of the astronaut and how they complete their extravehicular activity. If you see, even in the first extravehicular activity by Ed White, there was an emergency, medical emergency. His glove was lost and he was not able to enter. So he had to literally puncture his glove to squeeze through into the vehicle. And most recently, we have seen water inside the helmet in the case of astronaut Luca. And it was a real emergency, but luckily, due to his presence of mind and known emergency protocols, we were able to save the mission and save the astronaut. And we need to know each and every medical condition of the astronaut. After selection, they might develop due to the aging process medical conditions, but we usually give them waivers. There will be a personal flight surgeon who would be assigned for every astronaut, and there will be a standby too. And there are multiple environmental threats: temperature, altitude, the animal which will be utilized for the experiment. So they have to be really careful while handling those animals. And isolation plays a major role in the mindset of the astronaut. Like, imagine we are in the COVID-19 scenario where everybody is isolated in the home, and you get disturbed after some time. Like, if you are put in a single room for more than certain period, like, you crack up. So, but I have met astronauts, and most of them have a baseline quality that they have an overview effect. They always are calm and ready to face any stress, and they take it layer by layer. The final thing is cleaning or the hygiene task. Before, it used to be a very difficult proportion, but now with the planning of robots in the International Space Station, it has become much easier. Otherwise, every day the crew is going to spend hours and hours in cleaning the International Space Station. So let us briefly touch upon what happens in microgravity. Almost all the systems are getting affected with the microgravity. And the first one which is going to get affected is the neurovestibular system, also called as the space adaptation or space motion sickness. That's why usually you don't see any videos of astronauts after launch in the first 48 to 72 hours. They don't perform any critical tasks unless required, or otherwise we just put them on medication or a patch, usually a Scopedex patch or a promethazine, so that they don't throw up. This is because their orientation is lost. The cardiovascular system, as you see in the picture, there is a cranial shift or the blood shift towards the head. And you would have seen in many pictures that the astronaut's face become puffy and their legs become thin or chicken legs. To avoid that, they start doing their exercises. And in case of vision, due to the increased intracranial tension, there are some visual changes. But we have to appreciate that as the duration of the mission becomes longer, the changes become more and more pronounced and more difficult during return. And yeah, in the picture, it's actually on the right one, we were doing some familiarization of the International Space Station training mock-up, which is available at the Johnson Space Center. It's actually a trick shot. I'm not floating. It's actually a trick shot. And the second picture below, where I'm trying to egress from a Soyuz pod, you can see how crammed it is, and you three suited people have to sit inside that. Even now, we are using the Soyuz capsule as an escape pod, and until the SpaceX starts their own escape system, Soyuz is the only option right now. This is just a comparison between how a female astronaut and a male astronaut body behaves with microgravity. I'm not going into detail, but I just want to emphasize that when there was the expert group tried to say that female astronauts will have more problems during Mars mission, there was literally an outcry, and they were coming up with counterfacts and saying that they are no less or even better than the male astronauts. And now the actual committees, they have agreed that there is no difference between a male or a female astronaut. So what would be the diet? It would be usually protein rich, and carbohydrates or fats are balanced, and the entire calorie intake is tailor made by the nutrition team for that particular astronaut. What I have heard from them is that there is a change in the taste sensation. They wanted like more spicy kind of food, so even they add more peppers. And some people find it weird that the food items which they used to like at Earth, they no longer like it in their space environment. And exactly the opposite, like the food which they don't like on Earth, they started liking it in the space. And the food items are usually exchanged between the crews, and it's usually a diplomatic procedure. They use it as a diplomatic procedure, just to share the foods. And for every few weeks, it will be replenished by the supply missions. And there will be always a reserve food which is available. And you can see every astronaut carry cheat foods, like whatever they like they would carry. I've seen samosas being carried to the International Space Station. Diet becomes very important. This is one of my focus during my analog missions, and I was proposing that vegetarian astronauts do have an edge towards the others, because you don't need to carry food in your mission. You can grow them in International Space Station, or if you're planning for a moon or a Mars colony, you can start growing up in your own green habs. So my proposal was vegetarian astronauts do have an edge over it, and I always have a bias towards vegetarian food. Next comes the exercise. It's very, very important for the astronaut to exercise at least 2 hours per day. There are several equipments available on board. Even in space shuttle, which got retired, they had some basic exercise equipments. If you see the International Space Station, they have treadmills. There are 2 treadmills which are resistant based, Colbert and Aird, and they have a bicycle which they can use. Actually, they have run marathons in the space station. There are some onboard medical equipments in the International Space Station, and of late, the International Space Station is projected to be a laboratory. So they are putting more and more equipments over there, and the medical equipment for the main medical emergencies is stored as a separate kit. And there are both diagnostic and therapeutic equipments available. The picture where I'm in is taken from the space shuttle mock-up, where you can see I'm using a stick to switch on and switch on in the front panel, because when you are doing a re-entry, the gravity is so high you cannot even lift your hand. So that's why they are using a stick. And the astronauts, you can see they are using the ultrasound probes, both for study purpose and diagnostic purposes. So this is another question which I usually get: space surgery. Can we do surgery in space? To be honest, so far there has not been one surgical procedure which has been done in space on humans, but there are some surgical procedures done on small animals in the International Space Station. The main important the important thing which we have to consider is creating a field where it can contain the blood loss. You have to imagine you are in a microgravity or in a continuous orbital free fall. If the blood gushes out, it is going to go everywhere. So you have to have a contained field. That is the main requirement to do a surgery. The second limiting factor is anesthesia. The thing is, you cannot go for a spinal anesthesia. You have to settle either for an intravenous or intravenous anesthesia. Even inhalational is not being tested, but there are several hypotheses around. This is mainly because of the effect of the microgravity. And there is a picture on your left bottom where you can see that's a trauma pod, which is a concept which is a promising concept being under development. So what are the onboard medical research that have been carried out? They do a lot of tissue sampling, chip-based analysis, additive manufacturing or 3D printing, pharmaceuticals, and space developed pharmaceuticals are now in vogue. Like many companies have sponsored research in International Space Station, and they are saying that the molecules which are developed over there is so perfect that it can work better in Earth. And these are all ongoing research, and we can expect in another 2 to 5 years. There are several research which have been done on proteomics and genomics too. So we have seen what is happening so far in space. So your body has adapted to the microgravity environment. So what will happen when you are returning to Earth? You have to prepare yourself to get to 1G environment. So we have certain procedures and protocols how we can do that. Lower body negative pressure has been tried. This is basically like you are sucking the blood towards your feet. You can see an astronaut into a bag where there is a vacuum, like it is trying to pull the blood from the head towards the feet. This procedure is being started before the re-entry, and there are several cooling garments being developed. If you see, after landing in Russian cosmonauts, they are usually in seated position, and they will be wrapped in a cool blanket because they will not be able to stand. They will have dizziness because the blood supply will be mainly towards their leg, and the brain will have reduced supply, and they will feel dizzy. And the astronauts are used to keep all the equipments in microgravity environment. Like example, they can leave their coffee cup or a spoon. So they are programmed for that. If you see in a longer duration mission, the astronaut do the same on the ground also. I have heard from several astronauts dropping their glasses immediately after their return. So, are there any flight surgeon astronauts? Yeah, there are several. Actually, we have several physician astronauts, and I have met many of them during my limited career, and it was a very good interaction talking to them. So, if you want to become an astronaut after being a flight surgeon, sure. And the physician astronaut is the second or the third largest group among the total number of astronauts. If you see the total number of flight surgeons who have completed their MD residencies, the 3-year residencies, there are only 1,000 of them actively working right now. So it is a very small population. So how does space medicine helps? It's not just for the astronauts alone. There have been several technologies which have created a new or upgraded the existing medical technology. The CAT scan, the MRI scan have been it has been upgraded based on the space medicine technology. There have been foldable walkers, collapsible wheelchairs, even the 3D printing. You have seen several eyewears, implantable pacemakers, telemedicine. Everything has been advanced based on space medicine. So just to briefly touch upon analog missions. Um, so if you see in the entire astronaut corps, so far only 580 people have gone to space environment. So it is very, very limited, and so the medical data available will be very, very limited. In order to get some medical data, we start creating analogs or we develop similar environments. If you see, there are the Antarctic mission, the Arctic missions, it's a kind of analog. A submarine is a kind of analog. Even the COVID-19, right now, you are all in isolation for several weeks together. So it's a kind of analog. Just to give a timeline perspective, this is the medical view of an analog mission. First, you try to decide a mission, prepare for it. The actual mission happens, and then finally post mission. You take out whatever information is available and then compute it, and you can refine it and prepare for the future missions. So what will you do as a crew medic? And as a crew medic, I had done my primary objective is on-site medical management and maintain crew harmony. Beyond that, I have done everything. Like I assist my engineering officer, science officer, communication officer. You have to support your commander. So besides the commander of the crew, the medical personnel, the crew medical personnel is the only person who has a veto power to stop the mission on medical grounds. Crew communication is very important, and as I mentioned before, extravehicular activity, you have to plan it really well. Just to recap what we have talked about, preparation to become a space medical personnel, I have shown you different pathways. So you will be putting in a lot of efforts, maybe 10 plus years of medical school, residencies, and PhDs and whatnot. And you will be involved in crew selection, their medical management, their training. So the entire life of the astronauts will become an integral part of them. You'll be their occupational medicine specialist for them. And besides that, you have to focus on the mission. There are several ways you can support in space medicine. Not just being a personal physician of an astronaut, you can support in research, you can support in development of missions and planning of future missions. This is my social media account, and I have come to the end of my presentation. This is a very brief overview of space medicine. Each and every slide can be a lecture by itself. So I've just briefly introduced what is space medicine and how you can become one. I'll just leave the social media page over there. If you have any queries later after this presentation, you can always reach out to me.
It's so nice to know everything for a person who's not at all, so you can actually stop sharing your screen so that we could just
Sure.
have a few Q&A session. Yeah, thank you so much. As I said, you took us through, it was like space medicine for dummies. In fact, the previous space talk was about space law. Again, the speaker took us from like literally how it started to everything, and just the way even you have taken us through small things that's there in this field, and also told us what are the things that's happening and things like that. So first of all, thank you for that amazing talk, which you gave us. In fact, the whole audience would have for sure grasped a lot of knowledge about space medicine and a lot of things. We have a few questions which we can take if you're okay with it. So.
Yeah, I'm good. You can start with the questions. I'm happy to take those.
Lovely.
Yeah.
Great. So this is, in fact, I mean, I'd like to tell you one thing, that we, as a space education organization, a lot of students come to us telling that we want to become an astronaut. Then there are maximum number of people who come and say, I want to become an engineer, I want to become a scientist. But till date, I think 4 to 5 of them have come to us telling that they want to become a space doctor, or they are interested in biotechnology and connected to space, or space food, or something like in these lines, just like you mentioned. So at least for those 5 people, for sure this would have been very helpful. And we have one question, one among those 5 people who's actually doing her, I mean, she's actually a doctor and she wants to do her MD. So the question is something like this, and if you could answer that, I'll read out. Yeah. Could you please suggest an approach to choosing and applying for fellowship in space medicine for a psychiatrist? Look at that. She wants to look at space psychology. I don't know. I want you to answer that.
Yeah, we have a psychiatrist on team. There will be usually a lot of discussion going on between the flight surgeon and the psychiatrist. We are like frenemies usually. Uh, yeah, there is a career pathway. After the space medicine, the aerospace medicine professional, psychiatrist forms the important part of the team. Psychiatrist and psychologist. So the fellowships are really limited. I believe the person is from India. If she or he is from the United States, they have more options. But for a person from India, there is usually limited. You have to start working towards your along with the human space research program along with the ISRO. Right now, they have opened a directorate specifically for that. Probably you can reach out to them, or you can reach out to Institute of Aerospace Medicine in Bangalore. So they have psychologists, psychiatrists working towards the mission Gagania.
Great. Thank you very much. So there's one more question. How can a biotechnology student contribute to space medicine?
Actually, biotechnology is a big field. They contribute a lot, starting from your spacesuit, your communication. They form the integral piece for the human machine interface. So, whenever we have some trouble with operating on medical equipment or a suit, we go to the biotechnology personnel. They have an integral role in it. So they have to just focus on what they can offer to the space medicine industry, and they can. Their options usually are related to spacesuits, life support systems, or developing a new technology, 3D printing. All those are related to biotechnology. They have a good scope.
Amazing. Very nice to know. What do you say about space food? Like, not something that's already been existing. For example, you could also talk about space agriculture, if there is something like that.
Yeah, there is a space agriculture, or you call it a space farmers. So without food, Mars is everything for a rocket. So if you are carrying something, it is going to be a penalty in the rocket. So what if you can manufacture your own food in space? So that is going to save a lot of mass in the rocket. That is my focus actually. So that's why I say vegetarian astronauts do have an edge. So if you can grow something in space, you eat it there. Otherwise, at the end, it will be whether the animal or you. If you want to carry something to Mars, uh, whether you have to sustain the meat or yourself. So that's a so
Amazing.
that's a separate industry by itself, and there are a lot of spin-offs from
True,
space food
true.
industry.
Because I remember last year we had girls in STEM program where we had almost around 150 girls who had come from all over India to attend that program. And there was one student whom I clearly remember who said, "Ma'am, I wanna do something in space agriculture." So, yeah,
Uh,
that's
th-
that.
there is a food research laboratory, I believe. I think it's in Mysore, and there are several defense lab. They are the ones who are right now focusing on developing foods for space too. So
Amazing. Very nice to know, sir. And there is one question that I personally would like to ask. What do you think are something that's really going to be important in the field of space medicine, like in the future, let's say from 10 years now or from 20 years from now? What is something that's going to be really important, and what do you suggest the young people whom we have who wants to get into this field? What do you tell them that if you could tell us these are a few things that's going to be really important, and if you are interested or want to get into this field, you should work on these so and so few points like that.
so basically, if you want to become a space medicine professional, first you have to have the passion. So if you don't have the passion for this, because it's a relatively new industry, it started developing in the 50s, and it has exploded recently in the 2010s. And in India, it is even limited. If you talk something about related to space, it is a human space research. It is very, very limited even now. So you have to be really patient, and you have to pursue diligently into your field of interest. And I strongly believe that we are at the verge of developing the commercial space industry, and I'm sure that in our lifetime we are going to see something similar to what happened in aviation industry. So everybody will have a chance to fly, and so as a medical professional, you should be available. You have to take care of the pilots, you have to take care of the person, you have to take care of the passengers. So there is a scope. Beyond that, as of now, the space industry is focused on low earth orbit. The human space research has not gone beyond that, except for few Apollo missions. But it is going to change from the year of 2024, from the program Artemis. So we'll be having temporary or permanent lunar gateways, lunar missions, and maybe in few more years, maybe in 20 or 30 years, we might have some Mars missions too. So as you know, there is a time delay between Earth and the other heavenly bodies. So you will not be able to rely upon the mission control on Earth. So you have to be independent. I am sure that there will be definitely a space medicine professional on board in with every crew. So whenever there is a launch, there will be a medical professional. So you will become inseparable if you have
Yeah,
watched this.
I still remember long back when we used to have a human mission. We used to have one or two astronauts who used to be the space doctors itself, and now that it has come down because of something called as telemedication that has been working very well with everything. So, but then when we look at something of going far away from, as you said, like moon or Mars, I think that time we surely need space doctors. So yeah, it's really interesting and very nice to know that even people who are not from space, like that's what said. I mean, it's very basic thing that we all know that if it's an engineer and scientist, then you could actually be in the space domain, but no one thinks in this way, and very few, and for sure this should let someone with a curiosity to explore this domain as well. And one more question to you, sir: how can MD neurologist be correlated into this field?
Yeah, they are neurologists are part of the space medicine team. So I told you about the neuromuscular coordination, neurovestibular system. So we have a separate. There is in India there is I think a separate plan to develop a lab. So neurologist will be part of it. If you have seen the twin studies, Scott and Mark Kelly, neurologists were an important part of the team. So every specialty has a role. So the aerospace medicine or the flight surgeon professional will be the leader of the team, and he will even now. If you see a mission control, the flight surgeon would be sitting on his desk, and there will be a backroom team. There will be a team of medical professionals. So every specialist has a role. Ophthalmologist,
Amazing.
yeah, every specialist has a role.
That's so nice to know, and we are actually now experiencing the whole value of the doctors with the COVID-19 pandemic. We can't just imagine our lives without all of you, and it's a salute to all the doctors community from SSERD, and in fact everyone that you all have been helping the whole world with. I think it's a superpower that you all have got. Yeah, but it's amazing, and I would like to ask one question related to this. So, I mean, you also put in the presentation how this particular situation that we all are facing now, that being at home, is so similar to analog astronaut mission. So, there are a lot of students who want to know what is this exactly, like an analog astronaut mission, and in very few words, if you could tell what is that and who can be part of it and how can they be part of it.
So coming to the analog missions, we want to simulate certain conditions of the space environment on Earth, because we don't have enough medical data of astronauts, and it's the publicly available data is even more limited, and it's a matter of national security for every country. So how do we extrapolate the data? How do we know that which type of astronaut is required? What type of mentality is required? How do we design the procedures, emergency procedures, regular procedures, system engineering processes? That's why we create those analogs. The common thing which we simulate in an analog is the isolation, and you can increase the fidelity of the analog. It can be a low fidelity, mid fidelity, high fidelity. You can introduce multiple risk factors into it. It can be a closed analog where the entire system is self-sustaining, where there is a very minimal interaction in person. Like you can have interaction through telecommunication. In a closed system is an ideal system, but it's very difficult to achieve. Usually, we have a tailor-made analog setup in several locations. There are commercially available setups too. If you see, there is in USA there are 2 or 3 analogs which are the focusing on research for past more than 20 plus years. And if somebody has gone in a submarine, I have a picture with me taken in submarine. It's a type of analog. You are cut off from the rest of the world. So they want to know what is your experience. So that's how they see, okay, this type of personality is suitable for those environment. We don't want a personality who can be dangerous to himself or the other crew, who cannot work with the other crew. We don't want that guy over there. So that's the main reason we are doing all these analogs. Uh, I uh, I generally prefer analog personnel to be from different backgrounds, be it age, be it their educational background. So that will give like more knowledge for the research teams. They can get more data. So anybody is welcome as long as they meet the criteria. The only criteria which I put is like, don't kill yourself in isolation or don't kill somebody else. That's the only thing I say. But I think COVID-19 would have given many people that what is their mental capacity, whether they can sustain individually, whether they can see a person, be it a family, whether they can see their parents or siblings in a single room or a single house for a prolonged duration of time. You can see how difficult it is. So if you would have achieved it, I would say you have completed your moon or Mars analogs, depending on how long you have been in the same location.
Lovely, very, very nice to know, sir. I mean, yeah, I think most of us have experienced being an analog astronaut from home. We could call it home base, but yeah, it's amazing to know about all the the specifications that you said and everything. And I'm pretty sure this would have helped all our audience. And so this is the end of the show, but all the audience, thank you so much for joining. But let me extend a huge thank you from all the audience and from the SSERD team to Space Doctor Ashok Narayanamoorthi for joining us. I shouldn't be calling you sir, I should call you doctor. I keep changing this sir to doctor to
You
sir
can call
because
me. You can call me Ashok. In space industry, we just call by the first name. That's it. It's a small industry.
yeah, but it's so good to call you doc. So yeah, it's so nice. And thank you for accepting our invitation, sir. It was really wonderful having you and learning from you, and it was really amazing. Thank you so much. So dear audience, we will be back with another space talk soon with another space professional talking about another space related topic. So stay tuned. Until then, you can watch our other space talks here on YouTube. And don't forget to click on subscribe so that you get notified on when we start our next space talk. Thank you all so much. See you next time.
Thanks, everyone. Take care. Bye. Stay safe.